All right, everyone. So we're going to get started, and I want to just say first, it's nice to have you all here. The way this webinar works is that there's a question, both a chat as well as a Q&A function. You ask me questions there. I'll try to take a peek at them every few minutes, but mainly we'll probably save the questions for the end and try to go through all of them there. But if there's anything you're burning to know, definitely put them in that question and answer area or section. Okay, so first off, my name is Sean Peden. I'm an orthopedic foot and ankle specialist. I work for Yale University, and I'm based in Stamford on Long Ridge Road, 260 Long Ridge Road, where there's a medical center for both Yale and Greenwich Hospital, and I take call at Greenwich Hospital. So I'm a foot and ankle specialist, which means the majority of my work is on ankles and feet and doing surgery and taking care of things non-surgically. But another part of my practice is taking care of call, which means I'm the orthopedic surgeon on call for the hospital on certain days. And a lot of that is taking care of all kinds of fractures, from hip fractures to wrist fractures. And a lot of those fractures are preventable. And that's what the topic of this talk is today. So what can we do to prevent fractures? Because fractures are not only a major event for the patient, but they are a major event for the health system. They are costly for the healthcare system, and they can be life changers. A fracture, a particular hip fracture, spine fractures, can really change a person's future. So the focus of the talk is going to be going over the ways to prevent a fracture. So first off, with fractures, there are a few different kinds of fractures. So the first kind is a stress fracture, and that's where you have a bone that slowly over the course of time develops a weak spot. Think about a stress fracture as like if you've ever broken a paper clip, you slowly bend it a couple times, and it over time will develop a weak spot and then crack at that weak spot. That's a stress fracture. So where you gradually over the course, usually over the course of months, go from a normal bone to a broken bone. And these are typically caused by weak bone combined with an activity that's then causing it. The classic story would be the marathon runner, the person training for a marathon, and they develop pain in a bone from that. So this is what a stress fracture looks like. They're not as exciting to look at the x-rays. It's this cloudy area over this bone right here. This is a foot fracture that develops gradually over time. So that's just a weak spot where the bone's broken. Then there are acute fractures. This is what we usually think of when we think of a broken bone. And for the sake of, when you talk about with an orthopedic surgeon, a broken bone and a fracture, they're the same thing from our point of view. So an acute fracture means you go from a healthy bone to a broken bone like that. And that's from something like a twisted ankle. That can be a high energy broken bone, like the twisted ankle, or a kid falling from the monkey bars, which is a classic cause for forearm fractures, or a car accident. These are higher energy fractures, meaning somebody's really twisted their ankle badly. They were fall off from a height, say jumping off a 10-foot wall. These are high energy fractures where the bone broke because of the activity, not necessarily because the bone is weak. In these cases, this kid doesn't have any problem with the health of his bones. He just fell in a bad way. Okay. Then there are the low energy acute fractures. So this is where the bone breaks from something that really it shouldn't break. The example I would use is, you've got a little toddler, like my daughter a few years back. They fall probably a dozen times a day hard at that age, and they don't break their hip. Whereas one fall for a person with osteoporosis can lead to a fracture. And so these are really the fractures that we're most focused on today, are the low energy, meaning a fall from a standing height or even a slip in the bathtub, those sorts of things that can lead to a broken bone when maybe if the bone was healthy, it shouldn't have broken. So that's the idea, that these fragility or fractures that happen because the bone is at risk are preventable. So some really common places where you'll see these preventable fractures are the wrist. This is what's called a distal radius fracture, meaning the radius is the bone that goes from your elbow out to your hand, and you fall on that hand, like that picture of the person slipping on the ice just a few seconds ago, and the bone breaks at this level, just in front of the wrist or just before the wrist. And these are super common. They can happen in healthy bone, but they're much more common in cases of osteoporosis. And they are generally not life changers. I mean, they will definitely disrupt your life for a while, but they generally heal pretty well. Then there are these fractures. These are also extremely common fractures. This is a hip fracture. What we call a hip fracture is usually a femur fracture or a thigh bone fracture. The fracture occurs just below the hip joint. Here's the hip joint. It's a ball and socket joint. And there's a fracture just below that hip joint. And there's a few different variety of types of hip fractures, but they're almost all low energy fractures that you see in people with osteoporosis or that are elderly. And these are life changers. These generally almost always require surgery, even in people who are very limited. You really need your hip bone to be connected to your leg. And if that's not the case, that's where surgery comes in. Their femur is the biggest bone in your body. And if it's breaking from something as simple as a slip and a fall from standing height, that's a sign that the bone is weak. That, again, think about my 3-year-old toddler. When she falls, she doesn't break her hip because her bones are healthy. Okay. This is a bone that's weak and breaking because it's weak. A third very common fracture that we see that's related to osteoporosis is the vertebral compression fracture. So this is a side view x-ray of a spine, and these are the vertebra. And what happens is, from a fall, sometimes even just a hard sitting, this, like falling into a chair, compression of the spine occurs between two adjacent vertebra, and that vertebra in the middle gets squished and collapse. And you can see how it doesn't have that nice square shape. It's starting to collapse. These are very painful and can be sometimes even not even diagnosed for several weeks. You can walk around with one of these, but geez, it hurts and you start to get hunched over, and they can lead to certain surgical procedures and quite a bit of pain, disability, and deformity. You start to bend over, get hunched over, and again, it comes from weak bone. Lastly, another common one is what's called a proximal humerus fracture. This is an x-ray of the shoulder, and here's the shoulder joint here, and a fracture just below that shoulder joint, very similar to the hip, also very often caused by a combination of a minor trauma, low energy trauma, like a fall on your side, with osteoporosis. So as I said at the beginning of the talk, these fractures are very disruptive and problematic. They're painful. They often lead to surgeries. They lead to hospitalizations, trips to rehabilitation or nursing facilities. And the big ones are that they can really lead to a decline in the independence and function of an individual. When you take somebody who was previously fairly independent, maybe used a cane, let's say, for example, walking around the house or even getting out of the house, going to run errands and see friends. You throw a hip fracture on that, all of a sudden you've got somebody who's very dependent on people for help and many times cannot take care of themselves or do social things like going out to lunch or going to visit folks or drive a car, for example, due to one of these fractures. So, it can lead to, it's a major cause of leading people to end up in a nursing home or rehab facility. So that's why it's so crucial to prevent these fractures, because it's all about, orthopedics is all about, to me, maximizing function and quality of life. And to be able to prevent 1 or 10 or 100 of these fractures can really improve a lot of people's quality of life, because it's not just about living, it's about living well. So lastly, mortality after, for example, a hip fracture, the 1-year mortality, meaning if you have 100 people with a hip fracture, about 20% of those people won't make it through the year related to that hip fracture. And you say, well, how does a hip fracture kill you? Well, it can, because, well, initially you have the problems of the fall with blood loss, the stress on your body, and the surgery. But then in the longer term, that lack of mobility can lead to things like pneumonias, blood clots, bed sores, all those things. But I think what it really is, the reason why we see these rates is because it's a sign that the body is deteriorating when the hip fractures from something so easy as falling. So it's a sign that in general, the health of the individual is going in the wrong direction. So keeping the bone health good can really go hand in hand with keeping your function good and your general medical health good. So the easiest way to prevent fractures is avoid the falls, right? So if your balance is amazing, you're going to fall less. If you've got great coordination, flexibility, you're going to fall less. So balance is the key. And people say, well, I've got terrible balance. Why bother working on it? Well, sometimes it's about making your balance better. And for the younger folks in the audience, that's your focus, having really good balance now and keeping and maintaining that balance. But for older folks in the audience, it's about minimizing the deterioration of balance, because your balance as you get older goes down. It's just a simple matter of fact. So maintaining your balance by not necessarily doing this crazy pose here, but just simply doing some balancing exercises on one foot at a time can really, really make a difference in terms of preserving the balance that you do have. And that will help you walk better, and that will also help you avoid a fall. So, when we go to the gym, for example, and we work on our muscles, say we're doing these muscle curls, that's not really a simulation of real life. But balance is, if you're standing on one foot and your balance starts to go to the left, that is a real life experience. And the next time that you are out there and you slip on a little bit of ice, your body is going to be basically trained to react to that loss of balance. And then it's a complex thing. Proprioception is a fancy word for balance, really. But what it's really about is the communication of your body. When your body senses that loss of balance, either through the foot feeling that it's slipping, or from the balancing sensors in your body and your head and your ear, then how quickly can your body coordinate the response to then activate the muscles in your trunk or in your leg to prevent you from slipping to turning into a slip and a fall? And that's where I think, one of the biggest things you can do is learn balancing exercises. And if your balance is really bad, have a physical therapist work with you on improving your balance so that you can really know how to handle it yourself. And then getting into the habit of doing these things on a regular basis. It's not, you don't work on your balance by going to physical therapy 2 times a week for a month. You work on your balance by a lifelong process of every day doing a couple minutes of balancing exercises, or making it a part of your normal workout routine to do some balancing exercises, or every morning when you get up, you wash your face, you do some balancing on one foot. That is really the key. It's not like, similar with the next topic, which is flexibility. you don't stretch a couple times and all of a sudden become a flexible person. Stretching is kind of a lifelong process. And I think these things not only have benefit in terms of you're decreasing your risk of a fall, but where they really help is as well is just mentally. Exercise is good for your mind. It's good for your whole body. And a lot of times we're focused on, walk, but or go to the gym and lift weights. It's really more about coordination and flexibility. So this is an example of another exercise to really improve that single limb balance, simulating going up and down stairs. These are hard things to do. They really do require quite a bit of coordination of multiple muscles. And that's where practice really comes into handy. So when you're doing those balancing exercises, you're essentially training yourself to prevent that next fall when you do invariably lose your balance. So the exercises you do, one of the simplest ones is just balancing by holding on to a fixed object like a chair or a counter, a rail, those sorts of things. And then in this picture right here, just picking up one foot and getting good at balancing on the right foot for 30 seconds, balancing on the left foot for 30 seconds, maybe doing it with one hand at a time, maybe doing it with no hands. Depending on your skill level and your age and how good your balance is to begin with, you can always get better and make it harder by doing things like putting a pillow under this lady's foot, closing your eyes while you do it. There are lots of ways to make your balance better. And so the best way to do it is to have that full coordination of events rather than say, this muscle's weak, I need to strengthen my abs by doing sit-ups. When you do these exercises, you're working on most of the muscles in your body, maybe not your arms as much, but really working on your core muscles, your back, hips, and all the way down through the legs and the feet to improve your balance and stability. So this is an example of making it tougher, balancing on one foot, eyes closed with your knee all the way up. But there's a huge degree of things you can do. It is important to walk. It is important to get regular exercise. Whatever that way is that you like it, that's what you need to focus on. And that's, for some people, that's, going to the gym 5 times a week. For other people, it's getting out and walking. And when the weather's cold like it is now, walking in nice indoor spaces like these people mall walking here. Whatever you like to do that keeps you busy and keeps you active, get out and do that. So I do think some, regular cardiovascular exercise makes a big difference for sure. So what else can you do to not fall? Control your environment. So many falls happen in the home, in the bedroom, in the living room. Number one, avoid high risk scenarios. If you have balance issues or you've been diagnosed with osteoporosis, think twice about doing difficult walks up on uneven terrain. Some of the terrain may be loose. That's tough. You can't prevent a twisted ankle if you step on a root the wrong way. So really avoiding these high risk environments is step one. This is more appropriate for this time of year, looking out for that ice, thinking twice before you get out there and you step on a surface or you get out of that car because it's there and it's waiting to get people with weak bones. It's going to take them down. Using ambulatory supports. This is my second bullet here. Whether it's a cane, whether it's, who knows, but just using it goes a long way to preventing falls. Now, next is controlling the home environment. These are things we can, you can't always control whether there's going to be ice on the sidewalk, especially if it's not your sidewalk, but you can control this sort of thing. If you go to a home, a lot of times after a fracture, a social worker will go do a home visit with the person and really look at all these trip hazards here, the rug that's bunched up, the cord coming out, the papers on the ground, the remote on the ground, edges between, one room to another where there's a big kind of like a step. Preventing these, controlling the environment can really go a long way to preventing these fractures. And so it's something to look at, where you have to kind of say, look, maybe I do need to start wearing different footwear in the house or getting rid of that nice little throw rug because it's not worth it if I'm at risk for a fracture. Stable shoes in the house. I really am. Anybody who's heard me talk knows I love people to wear a solid house shoe, something with some traction. It does more than just prevent falls. It prevents broken toes. It's better. It's good for your joints. It's good for your preventing foot conditions like plantar fasciitis. So I'm a big believer in, and it's good for your skin too. It protects you from calluses, all kinds of things. I could give a whole talk about that. So, get yourself a good pair of house shoes too. Something that's easy though, slip on, comfortable yet sturdy. That's what I showed this picture. These are pretty sturdy slippers. This is why they give these out in the hospital, these rubber bottom traction socks, all these things. They're not glorious. They may not be fashionable, but they prevent fractures. So flexibility, why does that matter? Well, it totally goes along with balance. So maintaining flexibility is critical. Your body gets tighter, your muscles become less flexible, less rubbery, less elastic, meaning like a rubber band as you age. So preventing tightness is key, and it really does make a difference in terms of balance. You'll walk better, you'll feel better, and your body will be able to adapt better to losses of balance. So working on flexibility is another straightforward activity, and going to a physical therapist is not a bad idea, but that's not a lifelong thing for most of us. Doing these things at home for the majority of us is doable, and learning some basic exercises by, say, going on your computer and just searching, flexibility exercises for, your age group, or whatever you like, and finding some videos, finding some exercises that you enjoy doing. It's much more sustainable that way. If you pick out a bunch of boring exercises that take 20 minutes to do, I doubt you're going to stick with that. Maybe you're a really principled, committed person, but I think you're much better off finding something that's a little quicker, 5-10 minutes max, that you like to do. And then you'll be more in the habit of doing that on a regular basis. You'll be more likely to sustain that than you would be if you were to pick something you don't really like. So that's part of my advice. For a lot of people, that's yoga. And I know that people are probably sick of being told to do yoga. But those of you who do it, like I do from time to time, I don't go to classes. I just do little videos at home. Really know the benefits in terms of flexibility, strength, balance, and just mindfulness, I guess is the word. It's just, if you can make it a habit and part of your day, you are going to, in general, enjoy it and notice that it does benefit you in many ways, including fall prevention and fracture prevention. So I suggest you definitely give it a try. And one of the good ways to do this, again, is videos. All this stuff is available. You can go to a class, you can have an instructor. That's better, let's be honest. But with COVID, some of us aren't looking to bring new things into our lives. We all have a little different comfort level of what we want to do right now. And with the videos and the number of things you can find on the computer, looking up 5-minute yoga stretching routines, you may grow to like it. If you don't, try to find some other way to maintain your flexibility, especially for the guys in the group. A lot of the focus on fracture prevention is on women because osteoporosis is more common in women, but it is still very common in men, especially as we get older, and we have much more trouble with tight muscle tightness. In general, men tend to develop really tight muscles that starts, essentially at puberty. And so, when it comes to this thing, again, it's not something you're going to do for a couple sessions and all of a sudden you're going to be super flexible and the problem solved. It's going to be a habit of something you do on a regular basis. So falls are still going to happen even if we do all that. And then the question is now, how do we prevent a fall from becoming a fall with a fracture? So that's where bone health comes in. And as an orthopedic surgeon, we kind of have an interesting relationship with bone health. We tend to be the people you come to when the bones have failed. For example, when I'm on call and I get the call, so-and-so fell, broken hip, come in and see them. And it's too late at that point. Bone health is something that we all should be thinking about. And the specialists on this don't get enough attention and don't see enough of us when they should, which is way before the fracture, and prevent it. So that's why for a lot of us, it's the OBGYN who's the person who kind of takes on bone health, because it is definitely more of a women's problem. And the primary care doctor that focuses on bone health. Osteoporosis is a condition that can happen at any age with a low bone mass and disruption in the architecture of the bone, and the bone becomes demineralized. It goes from this nice, tight honeycomb pattern to a much more vacuous opening, and the rim of the bone becomes thinner, and the bone in between the rims is weaker. The bone loses its calcium and phosphorus, which makes the bone weaker and more at risk for fracture. So this bone on the right is going to be the one that breaks when you fall from a few feet. This one on the left, to break that hip would take a major accident, like a car accident or a fall from, multiple stories height. So what causes osteoporosis is a number of things. Age definitely causes it. Certain conditions can cause it, like eating disorders or stomach problems where you're not taking in enough calcium, or vitamin D deficiency, for example. There are also hormonal causes for it, which is why it becomes so much more common after women hit menopause. And idiopathic osteoporosis, where it's just a transient process that we can see even in kids and young adults. Primarily, it's women that get osteoporosis. 1 in 3 women will suffer from or will be affected with osteoporosis in their lifetime. Only 1 in 12 men. Really, what determines how good your bone is when you're at risk, meaning in your 60s or 70s, is how good your bone is when you're young. So unfortunately, we don't get this through to enough, especially young ladies, how important bone health is when they're a teenager and in their 20s, because what determines whether they're going to get osteoporosis has a lot to do with how strong their bone is at their peak, which is in their 20s. Certain ethnicities have higher risk of osteoporosis. In general, people with more of a frail body type are going to have osteoporosis more likely to have osteoporosis. So in general, it's Asian women and Caucasian women have a higher risk, but people can get it in all ethnicities. So screening for osteoporosis is one of the major ways we catch it and modify it. So it's recommended for women over the age of 65 and men over the age of 70 to be screened for osteoporosis every few years. And certain patients, like people who have early menopause or a family history of osteoporosis, or who just generally have conditions that would put them at risk, like these things listed here, are going to get screened more frequently. So let's say you break your wrist when you're 47 and going through menopause, you're going to probably want to get a bone scan shortly after that. Don't wait till you're 65, because that wrist fracture may have been the first sign of osteoporosis. And then you catch it then, and you prevent the hip fracture that may be waiting for you in your 70s. Certain medications can make you at risk for osteoporosis as well as certain medical conditions. And then the big one that I just mentioned is to screen for it after an injury. If you've had a fragility or a low energy fracture, talk to your doctor. We'll talk about the test, but it's a very straightforward, easy, pain-free test that can catch osteoporosis. So the test is called a DEXA scan. We also call it a bone scan or a bone mineral density scan. This is a routine test that generally your primary care doctor or your OBGYN, or we'll talk about it a little bit more, but an endocrinologist generally orders these tests, though one of those three doctors. And DEXA stands for dual energy X-ray absorptiometry. And it's really just like an X-ray. It's the same technology as an X-ray. It is radiation. It's very low radiation though, compared to say a chest X-ray or a CAT scan, which is orders of magnitude, meaning 100 times more radiation. They're painless and they're quick. It's a special machine. And in general, for screening, it's recommended every 2 years. The results of a DEXA scan can be a little confusing, not only for patients, but for providers too. The way they score you is by comparing you to a population. So let's just say, for example, my mom, who's in her 70s, has a DEXA scan. She's going to get compared to a population of the same gender, so women, at the age of 30 when they hit their bone mass maximum or peak. And they're going to look at certain areas of the body, in particular the femur, head, where a lot of those fractures happen, the vertebra, and a few other high-risk areas. And they're going to compare to those people how dense the bone is relatively, and in terms of looking at how that structure and whether you're getting the same thickness and structure, how much of the X-ray is getting absorbed by the bone is the measure of how strong the bone is, how hard the bone is. So if you're within one standard deviation, and these bars are standard deviations, which are basically chunks of the population, if you're in this main peak here, you are going to be diagnosed with normal bone. So the ones that get diagnosed with osteopenia or osteoporosis are going to be outside of this range relative to the healthy 30-year-old of the same gender. So in most cases, female. So if you're between 1 and 2.5 standard deviations on the weak side, obviously we don't worry about the people with stronger bone. That's great. But on the weak side of things, so let's say this is where the bone mass is decreased, it's over on this side, you're going to be in what's called osteopenia, which means you don't have osteoporosis, but you're in that direction. And then beyond that, when you get in that 2.3%, now that's not 2.3% of 70-year-olds, that's 2.3% of 30-year-olds. Then you're diagnosed with osteoporosis, okay? So what do we do with those diagnoses? We'll talk about that in a second. The way to prevent this from happening is by having good bone mass, especially in youth, really getting in the habits of healthy lifestyle, eating and exercising in a healthy way. And that a lot does include supplementation. There's recommendations in terms of how much calcium and vitamin D you should get depending on your age group. And, I think the downsides of supplementing with calcium and vitamin D, which is what this vitamin bottle I'm showing here is, are very low. So just including that in a regimen, just as like a vitamin or a mineral, it hasn't been proven, but probably does decrease the chances of development of osteoporosis, and probably does, at least the data would support, does improve bone mass when you're young. Exercise counts too, impact exercise. So that's what I was just talking about is, nutrition. And it's really hard to prove certain things. It's really hard to prove cause and effect. Calcium and vitamin D are two very important minerals. Calcium in particular, we seem to get enough of, especially in the United States, diet-wise. It doesn't seem to be a major issue, but for some people it can be. People who don't have any dairy, don't eat a lot of vegetables, those are the big sources. But vitamin D deficiency is a little more common. Vitamin D is something we get from, it's supplemented in a lot of our products, including, for example, milk and cereal. But it is also related to sunlight. And this time of year, there's not a lot of sun. That sun's low on the horizon. So you do need some degree of sunlight to actually properly metabolize vitamin D into its active form. So especially up north here where we don't get a lot of sunlight and we're inside a lot in the winter, vitamin D is something to keep track of. And we're looking at that in kids, we're looking at that in adults. It's deficiencies of vitamin D are associated with a lot of issues, especially bone and muscle and joint problems. Treating people with calcium and vitamin D, it's hard to prove that that really works, supplementing it well. So other ways we can treat it is, we talked about diet, exercise, medication. With exercise, we're generally talking about impact exercise. So walking, not the things I've talked about so far. That's, yoga and stretching. Those are about balance and flexibility. That's why the walking counts. Walking, it doesn't have to be running high impact, but step aerobics, classes where you're a little more on your feet are definitely good for your bones, because bones are living. They're not, a rock. They are alive and they respond to the stress of exercise by getting stronger. They have little receptors in the bone that sense, oh, I'm under pressure. I need to build up and get stronger to deal with that added stress. So medication is the last topic, and it's probably the most controversial, at least for patients. It can be a little controversial. Do I really want to take these medications? And, this is for everyone a discussion you should have with your doctor. But my general point would be the risks of these medications are very low. The benefits of these medications are very high. So there's a balance issue there. Obviously, no one wants to put themselves at risk for a problem or a side effect with a medication, but in general, these medications are very good, but it can be often very difficult to convince a patient to take them because they have side effects. So the first medication is the most popular medication that's been around for a while for osteoporosis. They're called bisphosphonate medications. They work. There's basically two main types of bone that are cells that are responsible for regulating your bone. Osteoclasts are the cells that remove calcium and phosphorus from bone, basically make bone weaker. And so the way these medications work is by blocking those cells. So essentially then the cells that build bone are working better, and the ones that break down bone are getting blocked. So your bone gets stronger that way. So it essentially prevents the bone from resorbing. And we all have them. I have osteoclasts. They're good for normal function, but the way these medications work is it blocks them slightly so your bone will get stronger. And these common medications, Fosamax, Boniva, Actonel, Reclass, they all have different mechanisms. Some are IV, some are a pill you take every day. And so it's a discussion with your doctor about whether they're right for you. They definitely work. They improve bone density. They decrease fracture risk. So it's not just that they make your bones stronger. They actually decrease the risk of developing a fracture. If you have osteoporosis, it's definitely something to consider. They have various side effects. There are some very rare side effects like causing problems with the bone in your feet, but it's so rare that the benefit of preventing 100 fractures for one patient, it's just a no-brainer. So there's a lot of other medications. It's an area of a lot of research where there's a lot of investment, because osteoporosis is common, it's costly. So spending money on medications to develop medications and give those medications really is a game changer. So there are emerging medications just in the last 5 years, several new medications that are designed to strengthen your bone through different metabolic pathways. One way at the bottom here that some of you may know about is called hormone replacement therapy. That was very popular, and then they realized that it has more side effects than we thought. So for the average person, it's not recommended anymore, but for some people, it is still something to consider. So these are things that, believe it or not, the orthopedic surgeon isn't the specialist for these things. And it's kind of an area of contention, because partly we want to control the bone and take it from start to finish, right? But the people that are really the experts and know the most about this are the endocrinologists. They're the ones who specialize in bone metabolism and hormones and the endocrine system, which is what hormones are. So what I would also say is beware of other treatments. There's a pill for just about everything, right? Supplements are very different from drugs. You go to a pharmacy or you go online and you look up a pill for bone health, and you'll find a lot of things that have a lot of claims that they work, but they're not FDA regulated. So you can basically say that it does whatever you want it to do, and with no one can tell you you're wrong or stop you from saying it. So you really have to be careful about supplements. Some supplements, like I talked about vitamin D and calcium, those do have pretty good evidence to support their use, whereas other ones don't necessarily have them. Like this is a new thing with strontium. There is some data to say that it strengthens your bone, but it's very new. And I would just be aware of it. Alternative treatments are alternative for a reason. Sometimes they do work, but often it's because they don't have a lot of medical evidence to support them. So I would just, anytime, let's say you say, oh, I'm not going to take those medications that are risky, I'm going to try something like this. Just talk to your doctor about it. I think you'll find most doctors are a little more open-minded than you think. And not all alternative therapies are bad. They're just, they're alternative for a reason. These alternative medications should be a supplement to proper evidence-based treatments, not a replacement. So, if you want to supplement on top of that, on top of proper treatment, the things I've talked about so far, getting your DEXA scan, taking calcium and vitamin D, doing exercises, those are things that are proven to help with your risk for fracture. These other things are not. So they should, if you want to put them on, think about it, talk to your doctor, but don't do them as an alternative. So in summary, the key is prevention with these fractures. And because when you get to the point that your bones are weak, it's just a question of time. We don't want you sitting around inside on a couch. That's no quality of life either. We want patients to be out and active. And so, sure, falls are going to happen, but we want to make them less by working on balance, wearing the right footwear, minimizing fall risks, and then make the bone stronger. So when the fractures do happen, when the falls happen, the fractures are less likely. Okay, so screening for proper bone health is critical. So I'm going to stop my screen sharing now. And if anybody has any questions, I'd be happy to take them. And it's a pleasure to talk to you all. I love educating like this, and I'd be happy to chat more about this or any condition. As I said, I'm a foot and ankle specialist with Yale at 260 Long Ridge in Stanford. And I do, education is an important part of my job. We want patients educated about their conditions and their risks so that they can prevent those things. So I'm looking in the chat. I don't see anything. I'm looking in the Q&A. I don't see anything. So I'll give you guys a minute or two if anybody, oh, there we go. We got one there. So there's a comment, doesn't look like a question, from Hannah about taking Axonel and Boniva for many years and there's no improvement in bone density. So some medications, when I say things work or things don't work, what I'm referring to there is the data overall. Not everyone responds the same. That's the reason there are so many different medications. And so, because you had a bad experience or did not get an improvement in your DEXA scan, A, doesn't necessarily mean that nothing can help you. And B, doesn't mean that it also didn't improve your bone strength just because you can't detect it on a DEXA scan. But that is the nature of these things. None of these things are 100%. We're talking about on the whole, if you treat 100 people like you, you're going to prevent fractures. So any other questions or comments? I'm happy to take any, respond to any comments. I don't claim to have all the answers when it comes to this stuff. but the data and literature does support that being proactive about osteoporosis is better. I tell patients, I'd rather see you in my office and talk about prevention than see you in the emergency room and talk about surgery. So there's a comment asking about reclassed. Reclassed is another type of medication that is a form of bisphosphonate. I don't have, like I said, these are medications that I know a lot about, but I don't particularly prescribe them. Endocrinologists generally prescribe them for people who've been diagnosed with osteoporosis. My thought on it is that every one of those medications in the bisphosphonate class, which are the ones that block the cells that break down bone, have a little different side effect profile, meaning one may cause more stomach upset, or one may have a higher risk of this, or one may have a different delivery mechanism, meaning it's an injection or it's a pill that you have to take every day. Those are very different. If it's something where you go to an infusion center like we have here at 260 Long Ridge Road, you come once a year and you get an infusion, an IV essentially. That's a lot easier for some people than taking a pill every day. So they all have a little different mechanism of action. So my short answer would be I don't have particular opinions about reclass. I like the name, and it's a bisphosphonate, which is part of one of the mainstays of treatment. So next, do you recommend any particular websites for stretching exercises? I recommend YouTube. I recommend personally, everybody's got a little different preference when you go, what kind of instructor you like or what kind of class you like. But on YouTube, you can find dozens of things. I recommend being a little choosy, watching a few of them, testing a few out, and finding an instructor that you like. And these things are free. They're, you watch a commercial or two and then that's it. So those are easy to get on your computer, or a lot of smart TVs now, or iPads, as a way to, you just pop on YouTube and you look up, 5-minute stretching exercises. That's what I think is best. I use a yoga class that I've seen, and I just do a 10-minute yoga stretch. It's called Sarah Beth Yoga, and it's just a very simple stretch. And they have stuff sorry, my light turned off, for beginners, and they have stuff for the advanced people. I think that's a great way to do it. So I have a question now from Phyllis and Jay. I take weekly generic Fosamax. Has the monthly pill been discontinued? I do not know the answer to that. That would be a better question for the pharmacist and the doctor who prescribes that medication. I'm sorry, but I just don't know the specifics of the individual medications, as well as you would probably like me to. So definitely a question for I think pharmacist is the right place to go, because if it's a thing where you want to take it more infrequently because it's easier to remember, there may be an alternative medication. A lot of times doctors are hesitant about switching medications. If a medication's working, switching them up can cause new issues. So I think it's a discussion worth having, though, if you think it'll help you be more compliant, because it's all about compliance. I give a patient an instruction, whether it's do this stretch or wear this brace or take this pill. They're going to be dose dependent. If you don't wear the brace and you're not compliant, it's not going to help you. If you don't take the pill, it's not going to help you. So that is an important part of these medications, and cost is a huge one too. I'm not going to, the medications are out of control, the prices, but it's a discussion to have with your doctor, and that they're expensive for a reason. Sometimes it doesn't make any sense why a pill is so much, but some of these medications really are expensive to make and expensive to develop. And so that's a question for, the politicians and the lawmakers and the pharmaceutical companies, that is way above my pay grade. But, sometimes it's worth it if a medication is going to keep you from breaking your hip or keep you from breaking your spine. I mean, that depends on the situation, but that may be worth it. So I'm going to give you guys another 30 seconds in case anybody has any questions. Like I said, I really enjoyed talking about this. If you have specific questions about medications, we have, there are many good endocrinologists, both private endocrinologists in the Greenwich market, who I would strongly recommend talking to about the specific pills and why one's better and one is not as good. Yale Medicine, which is what I'm a part of, has a great team of endocrinologists, including pediatric endocrinologists, all kinds of different levels. They are the experts in the medications for this. And unfortunately, I'm the expert in what to do after the break happens. But my goal is to keep you out of my office for that. So thank you for the kind words, Terry, and thank you everyone else for participating and making this a fun session, and hopefully you learned a little something and it'll spur your interest to learn some more. Everyone have a good day. Stay safe.